I think putting some of this into context as well. So when we talk about and when we hear various reports out about levels of vaccine in our communities, they're reported out in a variety of different ways that are not necessarily meaningful from a public health protection perspective. So reporting out the number of people who've received one dose of a two-dose vaccine, interesting, but doesn't confer the level of protection you need in the community to really have it be effective. When you report out on the people, the percentage of people who are eligible to receive vaccine who've been vaccinated, that's great news, but we have a whole population under the age of 12 who are not able to be vaccinated. And so, we really, from a public health perspective, need to be looking at the percent of the total population that has been vaccinated. And in the United States, we're still below 50% when you look at that number. We're at about 48%. That is nowhere near enough in order to stop the spread of COVID-19. The spread is fueled by unvaccinated people, but we know that there can be breakthrough infections. And as more people are vaccinated, you're going to see more breakthrough infections. And all of that then contributes to the increase in cases that I think we're seeing everywhere. So I know communities across the country are struggling now with which public health interventions to implement based on the rising cases. And it's a very, it seems like a cut and dry decision, but we've got communities that are incredibly fatigued and an economy that is trying to get back to, back to levels, restaurants that are trying to survive and stay open. So all of those factors, I think, go into trying to balance out community by community, the levels of intervention you do and the payoff you get from those interventions in terms of reducing the risk and reducing the spread. And it's going to be different from state to state and community to community based on, transmission levels. Here in California, for example, Los Angeles County, based on the trends they were seeing, re-implemented a mask mandate. So I think we know the tools that work. It's not rocket science. Public health tools, these basic tools of communicable disease control have been around for decades. Masking, physical distancing, vaccine, they work. They are tried and true. We just have to be sort of judicious in how we implement them in ways that will get us the best outcome for our communities.